The reason we're here is to talk about suicide and suicide prevention. We were talking about statistics earlier. Around 700,000 people die by suicide every year. So that's someone around every 40 seconds. And for every one person who dies, 20 more will have attempted suicide. It occurs through the lifespan of a person, and it is the fourth leading cause of death amongst 15 to 29-year-olds globally. So it's an issue everywhere. Around 78.9% of suicides occur in low middle income countries. And as people will know, who know United, that we're very keen to remind people of the situation in low middle income countries, as well as high income countries. And one of the things that we've worked on a lot is trying to decriminalise suicide. So suicide is illegal in at least 20 countries, which in itself causes further stigma and discrimination and prevents people from seeking support. So those are the kinds of topics that we've been thinking about. Really pleased to have you here to discuss it this evening. In terms of what we're going to do, we're going to have a brief conversation where I'm talking to Zak Williams, who's to Alexandra Fleischman, who leads work on suicide at WHO, to Peter Yaro from Basic Needs Ghana, who's another trustee of ours. And then also talking to you, James, about our work on suicide decriminalisation, and then really listening to Devora Kestel, who is all of our bosses really in the end, because she leads the work on mental health and substance use at WHO and is the leading UN organisation on the issue, and obviously a leading expert globally in mental health. So very, very lucky to have her.
First, to share my story, my name is Zak Williams. I'm a mental health advocate and a co-founder and CEO of the mental hygiene company PIM. My story relating to my mental health journey started very early on in my life, actually as a teenager. But after my father, who was an entertainer, Robin Williams, died by suicide, I found myself very dysregulated, diagnosed with post-traumatic stress disorder, generalized anxiety disorder, and depression, and had suicidal ideation. Through that experience, I discovered mental health advocacy was very healing for the trauma, and discovered lifestyle interventions specifically focused on fitness, nutrition, mindfulness, meditation, community support, and other elements were very healing for me personally. But through my journey, specifically focused around mental health advocacy, I discovered United for Global Mental Health as an organization that's doing incredible work internationally. And through now, at this point, it's been nearly 4 years we've been collaborating together. I've learned all specifically what's been going on internationally, but have seen a lot of mirroring occurring in the US. And in the US, relating to suicide attempts, suicidal ideation, and ultimately suicides, I see this as a canary in the coal mine of what's going on with the mental health crisis in general. We have a runaway situation akin to climate change that if we don't establish specific measures around systems change, is going to continue to progressively become more and more of an issue. This involves elements like decriminalization of suicide, but also extending beyond that, looking at how we can establish preventative measures to support people prior to them going into a state of crisis. Culturally speaking, in terms of stigma, in terms of policy, both in terms of what's going on in the US and in terms of what's going on abroad, we need to establish a concentrated focus around changing the language, changing the orientation around crisis intervention and preventative care focused around things like suicide prevention, suicide ideation, and ultimately decriminalization of suicide. So we need to take a systems-based approach towards managing the issues. And the reason why I'm so passionate about this subject specifically is that in terms of it impacting me, suicide as a suicide survivor, but also learning about the systems at hand in terms of programming, awareness, research, advocacy, and policy, I'm discovering that we're really at the early stages of what systems change looks like to create a preventative leading into a crisis care spectrum of support services and culture change that needs to be applied to change the way in which we view taking care of our communities and the individuals that make them up at scale?
Suicide has been recognized internationally, and it was included as an indicator in the UN Sustainable Development Goals, and notably, it's the only indicator, the reduction of suicide rates, it's the only indicator that was included in the mental health area. So this is what we will be measured against. But if suicide rates continue decreasing at the current pace, these global targets will not be achieved by 2030. So much more is needed. Like we heard, we are at the start. We need to have a bigger effort. So why live life? So this is basically that we have to bring suicide prevention to where it happens. We know what works, but it needs to be implemented. This is the issue here. And we have to narrow it down. We have to make suicide prevention accessible, and we have to focus. So what do we focus on? We focus on the evidence. Where is the evidence? What are the key effective evidence-based interventions? There are many things one can do, but according to the evidence, it's really about limiting access to the means of suicide, and many lives can be saved there, no matter whether it's about barriers on bridges or pesticides, which actually account for 1/5 of all suicides. But we have seen in an example like Sri Lanka, where over 20 years, 70% reduction in suicides could be achieved with 90,000 lives saved. So these are really where lives can be saved. Then the interaction with media is another important intervention. And it's not only today about the responsible reporting of suicide by the media, so not to show the method and not to glamorize it. It's also to work with the media and the journalists to train them. What are the stories that they can tell? There are stories to tell about how someone was coping with their problems and how someone was receiving help. And this is where people are encouraged to seek help. Then another area is, of course, young people, and there's an ongoing initiative in collaboration between WHO and UNICEF on fostering life skills for young people. As we have heard, it's a leading cause of death among the very young, 10 to 15 years, third leading cause of death for young girls. This is really sad. This is dramatic. And then, of course, we have the health sector response to early identify and support anyone affected, to follow up with someone who presents with a suicide attempt, but also to provide the care for those who are left behind. And here you see in Live Life, that's already a lot to just concentrate and focus on 4 key interventions. And you also see on the left-hand side of this slide that these interventions need to be supported by foundations like situation analysis, multi-sectoral collaboration. You see, suicide prevention is not only about the health sector response. There are different sectors involved, and we have to manage to address all this and bring all of them to the table. Live Life approach, we also have a plan for implementation, which is, of course, to provide the guidance and materials needed. So we published in 21 the Live Life implementation guide, really a step-by-step guide for countries with many examples for the key interventions. But now it's also about further breaking it down into orientation materials, into briefing notes, into smaller pieces that can be more accessible to countries, to policymakers. And then, of course, as I said, we have to interact with countries and engage them in suicide prevention. And countries are at different stages. So in some instances, it may be to raise awareness and advocate and acknowledging suicide by countries as a serious public health problem and entering into a policy dialogue with them. But in other countries, there may already be some scattered activities where we provide more strategic support on bringing the different stakeholders to the table, or it's about training, capacity building in countries. And then, of course, data. We need better data, and we are providing manuals for hospital-based surveillance of self-harm and also for community. This is something we are currently working on better surveillance of self-harm or suicide in communities. And this, of course, feeds back into the first point here. This data, this information about the size of the problem is needed to advocate for suicide prevention.
As a Ghanaian citizen who have grown up in the country, we were made to understand that suicide is a taboo topic, not to be discussed, because if you do that, you are bringing calamity to yourself. So as much as possible, you are not to mention suicide in a conversation. And if someone dies by suicide, knowing the way people are buried, your grave is sealed forever, never to be opened for any other burial. That site becomes a desolated area. So suicide is having or suffering the stigma that mental health is generally also suffering and have to. Now knowing that the Criminal Code 1960 up 29 has made suicide a criminal act, a misdemeanor that could end you in prison, there was need to break the silence. It's very true that suicide ideation and suicide in Ghana, it's something very pronounced and need to be talked about, even though swept under the carpet. So yes, to your question, suicide issues need to be discussed head on. And we have taken up to advocate for decriminalization of suicide on the grounds that people need more support than being made to face criminal justice because of a clear exhibition of a need for support. And we have pursued this over the years now, but gain more impetus with the support of United that took up suicide a few years ago to discuss it. And as part of the Speak Your Mind campaign in 2019, we took up to talk about suicide decriminalization as part of another provision that described people with mental health conditions as imbeciles. So we, as an organization working with a host of people with lived experience, are calling for the government of Ghana to expunge the provision that criminalizes.
Talk to you a bit about what United for Global Mental Health, a global civil society organization, is doing within this area. And firstly, just to get to our motivations. Well, other than those who have already been explained, for us as an organization which is looking to strategically make a difference around the world in a number of countries, those countries where the national legislation is criminalizing suicidal behavior is a red flag for us, that the rights or mental health rights of people within that country are not being upheld to the highest standard. And so we can focus our efforts there in terms of rights work amongst the other projects. And how do we do this, and sort of what is our approach? Well, there's a framework that we work to. There's three things that we see need to happen to make sure that suicide is decriminalized across the world. One is that suicide is decriminalized legally in all the countries where it currently isn't, that no new countries criminalize suicidal behavior, and there are countries in the world where new bills are being tabled into parliaments to criminalize suicidal behavior. It is a dynamic argument, this, and one that's not simply heading in one direction, but there's a huge amount of defense that needs to be done, as well as proactive work in countries. And we're also pushing the international community to make sure that this issue stays on the agenda. We need to have international focus so that those commitments that are made by governments about how they approach mental health, done in full view of their peers of other governments, include decriminalising suicide. We know that this is a well-trodden strategic approach to influencing government changes, doing it at the international and national level. What have we done about this? Well, we started work on this issue in 2020, and that led to a report that we published in 2021, which was simply looking at the 20 countries where suicide is criminalized in common law and identifying exactly where within the legislation is suicide criminalized within the law, what attempts have been made to change that, is there precedence in case law? And we worked with an international law firm as well as the International Association for Suicide Prevention and the Thomson Reuters Foundation to produce that. And we've felt, and we know that a number of campaign organizations across those 20 countries will be able to use that information to be able to construct arguments and plan what they want to do in terms of changing that legislation in their country. So we will continue to work at a global level to produce these types of resources that we know are useful and being asked for by national partners. And we will continue to work with the international community to be really pushing this as an agenda item and not something that's going to be forgotten about just because of the low number of countries totally where suicide is criminalized, because it's such an important issue. Continue to support national partners as an international group with staff based all over the world. We look to, where possible, provide technical assistance and support for countries. And what does that look like? Well, often it is very technical. And when we're dealing with legal changes or legislative changes within countries, often we found on this particular issue that the sort of wide public campaigning is effective, but also coupled with very technical, precise political work. An example would be in Guyana, where suicide has recently been decriminalized. We worked with the International Association of Suicide Prevention to provide joint policy statements and documents that local civil society were able to then to put in front of the health minister to be able to guide their arguments and show that there's an international work happening behind that. The situation around suicide is incredibly complex in Pakistan. However, I am very pleased to say that a bill has passed through Parliament and the Senate and is now awaiting presidential assent, which is incredibly exciting. There were a number of barriers that were preventing suicide from being decriminalized in Pakistan, but there are two in particular I'd like to mention. One is the religious aspect. And the civil society organization Taskeen, who's a very close partner of United for Global Mental Health, and having taken this issue on for a number of years, very courageously and incredibly skillfully took on that argument about where does suicide fit within the Islamic religion. And we're able to produce an argument that essentially was saying that suicide isn't incompatible with the Quran and with the Islamic faith. An incredibly impressive and skillful thing to do, which worked particularly well with elements of the Pakistani government. But we also know that the Pakistani government does react to international attention. And so we worked with the Guardian newspaper in the UK to produce an article which was looking at the issue of suicide within Pakistan, and particularly putting a highlight on the fact that it was still criminalized in Pakistan and what effects that was having. And that included having survivors' testimonies that were anonymized, witnesses to issues with the police around suicide criminalization. And that, along with a lot of efforts and huge amounts of people, has led us to where we are. We're looking to create reports specifically designed for each of those countries, where we speak to, first and foremost, the stakeholder that is most important, the person who's exhibited suicidal behavior, their families. What do they go through? What process have they been through? What are their experiences when it comes to having tried suicide in these kinds of countries? Their exposure to the police, their exposure to medical officers, the way they're exploited. And for those that have been through the arduous process of the entire legal procedure that follows, some that have been incarcerated, like what they've been through. And I feel like that emotional and like true factual story is going to be very, very influential
But also, if you speak to police officers who are actually part of the process, if you speak to the lawyers involved, speak to medical officers, even the judges and some policymakers who may not necessarily come forward themselves out of fear of stigma, but are more than happy to give their account behind closed doors. And even some religious leaders for that matter. For example, in Pakistan, the Council of Islamic Ideology had a clear stance, but then when you spoke to them individually, they understood the issue and they understood the people behind it. So getting their stories, getting them into a report, doing research around that, and then presenting that to select policymakers that we can approach and supporting our partners to approach them. I think that could be one way to address the issue, even where collecting that hard factual data on suicides has to keep happening on the side. But until that happens, that's what we plan to do in the immediate future.
Suicide prevention is lagging behind. And when I was listening and thinking about definitely the criminalization as a barrier, but also the religious issues. And it's not only what Peter said, but I was actually thinking about entire countries where you can't talk about that because it is going to be bad for the family and for the community. And so I think that the strategies used in Pakistan should be better known and disseminated because they will turn useful in many other countries. Just the crisis support that is needed, but is the intervention before, is the possibility to think that something is there. And we know what needs to be done. We know what are the strategies that you heard from Alexandra. So what I think is that what the point comes now for us to ask for pledge for funds to support the implementation of Live Life across as many countries as possible. Right now the pledge we are asking for is 2 million because we believe that with those funds we should be able to implement this initiative and the different strategies in several countries in the 6 regions where WHO works, and engaging, similarly to what has been done in Pakistan and multiplied by the different components of it. So that would be for us one concrete next step to move to help everybody moving forward and making sure that the beautiful initiative that Cynthia presented is also available in many other countries as well. And that even the support services that are, for example, in the US that were mentioned earlier are also available in Ghana and in everywhere else. So that would be, I'll stop here.
I want to thank you for hosting this really incredibly important session, and to all the speakers and participants that are on. This is clearly an area of, very great concern for the foundation and for all of us. I think we share this great drive to try to make change in this space. It's something that we follow very closely at Born This Way Foundation, both through research, studying it, and also programs, one of which is an initiative called Please Stay. I just want to briefly mention that. It's through a partnership that we have with an organization called Find Your Anchor that was developed by a young woman who is a 4-time suicide attempt provider. And, the whole objective behind this are many tools to help with what's been top of mind to everybody on this call, which is both prevention and intervention. So there's a lot of tools there. And there's also a pledge that we have had so many youth take that's called Please Stay, that encourages young people to find an anchor in their life. It's through Find Your Anchor, that could be really anything. It could be 30 seconds of breathing, a mentor, somebody a trusted person that you turn to, an anchor that keeps you in this world. So that's Please Stay. We're continuing to expand our work in that space. And Sarah, as you know, anything that we can do to help support and amplify and help accelerate any of these wonderful causes, we are very happy to do.